Welcome back to the Knowledge Academy's YouTube channel. Touring a safe and healthy working environment for all employees is paramount for any organization. Today, we'll delve into the significance of risk assessment and management, the step-by-step process of conducting a risk assessment, and the various risk control measures that can be implemented to minimize the likelihood of accidents and injuries. So let's get started. The significance of health and safety risk assessment and management. Risk assessment and management are cornerstones of workplace safety and health. By identifying potential hazards and assessing the associated risks, employers can proactively eliminate or control these hazards, safeguarding the well-being of their employees. Why is risk assessment crucial? Number 1. Prevents workplace accidents and illnesses by identifying and addressing hazards before they cause harm. Risk assessment proactively reduces the likelihood of accidents and work-related illnesses. Number 2. Protects employees' health and safety. A thorough risk assessment ensures that employees are not exposed to unnecessary risk, creating a safer and healthier work environment. Number 3. Enhances productivity and morale. A safe workplace fosters employee morale and productivity as workers feel valued and protected. Number 4. Minimizes legal liabilities. Proactive risk management can reduce the chances of workplace accidents and subsequent legal liabilities. Steps involved in conducting a risk assessment. Conducting a risk assessment involves a systematic process of identifying hazards, assessing the risks associated with those hazards, and determining appropriate control measures. Here's a detailed breakdown of the steps involved. Identify hazards. Walkthrough and observation. Conduct a thorough walkthrough of the workplace, observing work activities, equipment, and processes to identify potential hazards. Employee consultation. Engage with employees from different departments to gather their insights on potential hazards they encounter in their daily tasks. Accident and incident records. Analyze past accident and incident records to identify recurring hazards that need to be addressed. Regulatory requirements. Review relevant safety regulations and industry standards to identify specific hazards that need to be assessed. Assess the risk likelihood for each identified hazard. Determine the likelihood of an accident or injury occurring. Consider factors such as frequency of exposure, task complexity, and employee experience. Severity. Assess the potential severity of the consequences if an accident or injury were to occur. Consider factors such as potential for fatalities, permanent disabilities, or long-term health effects. Risk evaluation. Rank the identified risks based on their likelihood and severity to prioritize control measures. Implement control measures. Hierarchy of control measures. Follow the hierarchy of control measures to prioritize the most effective methods of risk reduction. Elimination. Eliminate the hazard altogether, if possible. For example, replace hazardous substances with safer alternatives. Substitution. If elimination is not feasible, substitute the hazard with a less hazardous alternative. Engineering controls. Modify the workplace or equipment to reduce exposure to hazards. For example, install machine guards or ventilation systems. Administrative controls. Establish procedures, training, and supervision to reduce the likelihood of exposure to hazards. For instance, implement safe work practices and provide safety training. Personal protective equipment, often referred to as PPE, provide PPE such as gloves, goggles, and respirators to protect employees from hazards that cannot be eliminated or controlled through other means. Selection and implementation. Select the most appropriate control measures based on the specific hazard and risk level. Implement these measures effectively, ensuring employee understanding and compliance. Monitor and review. Monitoring effectiveness. Regularly monitor the effectiveness of the implemented control measures. Observe work practices, conduct safety audits, and gather employee feedback. Reviewing risk assessment. Periodically review the risk assessment to reflect any changes in the workplace, work practices, or regulatory requirements. Update the assessment as needed to ensure ongoing effectiveness. Conclusion. Risk assessment and management are ongoing processes that require commitment from all levels of the organization. By implementing a comprehensive risk assessment and management program, employers can create a safer and healthier working environment for their employees, reducing the risk of accidents, injuries, and illnesses. Remember, a safe workplace is not just a responsibility, but an investment in the well-being of your employees and the success of your organization. If you enjoyed this video, hit the like button and subscribe to our channel for more exciting and informative content. Don't forget to turn on notifications so you never miss an update.